He's now told CNN's Fareed Zakaria about the need for reform right now.
Speaking of hard negotiations, what message would you have to the Senate Democrats who seem to be holding up the passage of a comprehensive health care bill, or are they amending it in ways that are useful and productive?
Well, actually, I think that it's a very healthy process that's going on. There are differences, and there are serious differences in viewpoint, for example. But what the president has said, and what I believe is the right approach, is that this can't be put off any longer. You know, back in '93 and '94, when I was on the front lines and taking all the incoming fire on this issue, people didn't really accept in their gut that we had to do this. They kept thinking there's another way, and it's not that bad, and we'll try, you know, managed care, and we'll try more HMOs. We'll try all of that. And now, all these years later, we realize that we have some fundamental problems with our existing system that have to be addressed. So I actually believe that at the end of the day, with all of this negotiation and back and forth, you know, we're going to come up with something. My hope is that it's going to be meaningful enough to make a difference on the cost side, which is the paramount issue for people like us who have insurance. Okay, how do we keep affording it and making sure that it is of high quality? Assurances that what we're going to do on the public side, the Medicaid and Medicare programs, are not going to undermine those programs in ways that they can't deliver cost-effective quality care. Getting people insured and moving as rapidly as possible toward universal care. Changing the delivery system and the incentives so that we actually figure out ways to reward prevention, pay for prevention. You know, in '93, for example, Fareed, I have a man who became a friend of mine, but I didn't know him at the time, Dean Ornish. He came to see me, and he said, look, I have proof.
This is the doctor
who did a lot of work on cardiovascular health. And he said, I have proof that changes in diet, stress reduction, exercise are as effective, if not more effective, than medical interventions in lowering people's overall threat of heart disease. He said, but I can't get Medicare to pay for somebody going to an exercise class or to pay for a nutritionist to come to their house and talk to them. Well, we worked and worked on that all through the time my husband was president. And then finally, sometime during the Bush administration, the Centers for Medicare and Medicaid, CMS, said, okay, fine, we'll begin to pay for this. Well, it shouldn't be that hard. You know, we're more than happy to pay for a pill or pay for a procedure. How do we change behaviors? How do we convince, you know, the medical establishment to do that? There's just a lot that needs to be at least included, even if though we can't get to the finish line right away.
You're passionate about this. Do you ever wish that you were back in the White House running this?
Well, I feel like you know, I gave my blood, sweat, and tears, and I think we, despite all of the difficulties of that effort, we got people thinking, and we helped to further the debate. It was, you know, disappointing that we didn't get it all done, but we got, you know, the Children's Health Insurance Program done. We got portable insurance. We got some things accomplished in the '90s, and actually under the Bush administration, some changes were made so that the government said to hospitals, we're not going to pay for what are, you know, never events. You know, nobody should get bed sores. People should be given aspirin if they come in and give their pneumonia shot, things that are really should be required. So we made, you know, progress, but the problem is that we just never got to a critical mass of progress, and that's what I'm hoping to see now.
Madam Secretary, thank you so much.
Good to talk to you.
Pleasure.
By the way, you can see the entire exclusive interview with Secretary Clinton on CNN's Fareed Zakaria GPS. They talk about a lot of subjects, including Iran, North Korea, the war in Afghanistan, all this Sunday afternoon at 1 p.m. Eastern, only on CNN.
We all want an America defined by deep and meaningful equality, from civil rights to labor rights, from women's rights to gay rights, from ending discrimination. There are no acceptable limits, and there are no acceptable prejudices in the 21st century in our country.
We have a common task and a common challenge.
Why can't we see that we are all in this together?
18 million of you from all walks of life. Women and men, young and old, Latino and Asian, African American and Caucasian, rich, poor and middle class, gay and straight, you have stood with me. And I will continue to stand strong with you every time, every place, and every way that I can. The dreams we share are worth fighting for.